So once again, Dr. Malau, thank you for joining me for this afternoon session. This is a special episode, if I can call it a special episode, because we will be reflecting on the last 50 years of PNG's health sector. We may not be the right people to have this discussion, but we feel as citizens and as people who care about our future and our children's future, we want to reflect in our own way, our own personal experiences. And with me this afternoon, I have someone who is very experienced in the health systems within the region. You may have seen him in our future. Sorry, you may have seen him in our past episodes, and I will let him introduce himself, and then we can begin.
Thank you very much. I think we did have a pretty good introduction already with our past interactions. So if people are interested, they can revisit our interaction to see what I had done. I think the first episode that we would have covered that. But I'm now retired, or I guess I would say not retired, because I really am passionate about still doing something for our country. And that's why I'm really blessed to be with you, Dr. Itaki, because the sort of questions that you've raised and we've spoken about directly with each other seem to show the rationale and justification of what we want to do. And for the so I guess I need not go through my introduction again, who I am. People would have seen me as, Dr. Condom and all from the early days to when I just finished off my most recent input with the provincial administration in the East Sepik province. So I can just begin to get what you'll be asking about, and we can just focus on those, if you don't mind.
No problem, no problem. Just for those who may be seeing this for the first time, I have with me Dr. Clement Malau. He is former Secretary of Health for PNG. He has held various senior roles within the region, working with the World Health Organization, Burnett Institute in Australia, and at one point he was the Secretary of Health for East Timor in its foundation years. And I am very honored to have him for this special episode to discuss and reflect on the health sector for PNG since independence.
In fact, sorry, just one little thing. I was not secretary in East Timor. I was the project manager for a project management unit that was created by the World Bank to head the project management in East Timor to begin the process of fixing up health systems in East Timor.
Thank you. Thank you for the
clarification. Thank you.
Thank you for that clarification. In this episode, we are reflecting once again 50 years of independence. And in our episode, we are focusing specifically on the health sector milestones, challenges, and perhaps missed opportunities. And I have someone who is very special to share with me this reflection journey this afternoon. And to make our discussion maybe in a more organized manner, I have divided our sessions into decades between 1975 to 1985, and 85 to 95, 95 to 2005, and so on, fifth decade between 2015 to 2025. So Dr. Malau, if it's okay with you, can you share some of your reflections generally between each of the decades starting from 75?
Thank you very much. 1975 is when we got independence. The country got independence. And at that time, many of us were just going to school and just started off in medical school. We just, in 1980, some of us graduated in 1980. So what I'll basically provide is very quick historical aspect of what we felt like when we were students and becoming doctors in the health system in our country. So what I can say is, at that time, I think maybe most of us went through this stage of understanding each other without knowing what for health specifically, without knowing what is there, what was there. But then as we went through school, there are a couple of key things that I think we experienced. Some of us went to school in very diverse settings. I went to school in a mission school in St. Joseph's in Ambunti. Now, I have a feeling that many of our experiences would have made us to be what we are. So in my generation, I think the 1975, when we got independence, we had no feeling of, oh, I wanted to be this, I wanted to be that. We just became doctors, nurses, because somehow we became doctors and nurses, or community health workers at that time. The only thing we knew was our people were going through a process of colonization. In the process of colonization, many of our people from throughout the country were APOS orderlies, and they're working like that. So I find that when we, as citizens of our country, we came through a process of basically finding out ourselves. That was the first phase, I think. The first phase of, say, in the 1970s. What we were seeing, what I was experiencing was just trying to see what was happening. So, I keep on mentioning this thing about Stone Age to Space Age. That's the first phase, I'd say, is that phase of Stone Age where we were trying to find out what health was like, what was happening. So during the process of understanding this, we came to know people like Carlton Gazusak, Nobel Prize winner for medicine. And yes, I must now say about late Michael Alpes. Those were the researchers that gave us some thoughts about, hey, what's happening in the highlands of PNG, Kuru and its aftermath. What's happened? Then we met people like Ian Aitken, whom I met at Harvard, who actually mentored me at Harvard. So he was in Kainantu. So we had the scope of experiencing things from seeing our mentors beginning, the mentorship, in us trying to work out what we were actually meant to do for our country. So we are fortunate. We went through the MBBS program. In fact, during our other studies, we met with students from other parts of the country. I mentioned my best friends from Milne Bay and from Manus, Dr. Howard Bayagao, late Howard Bayagao, and Dr. Chalau, who is now CEO of the Paradise Hospital. Again, my classmate too, Dr. Sios, is heading that hospital. I'm so proud of them because it shows that we have come somewhere during this period. It shows that Papua New Guinea has developed. Health systems have developed to an extent that we are now having CEOs of hospitals, all these sort of things. So that's the scope of understanding that I hope that your other questions will clarify. those period from pre-independence to current day, where we are at the moment.
Thank you for that brief overview of where you were and up until now. So, Dr. Malau, you graduated from university as a doctor in 1980.
Correct.
And at that time, what was our health system like?
First, I must highlight we had real big champions at that time. We saw people like Professor John Biddulph, a pediatrician, but he also influenced us very, very well in actual understanding even the standards that I keep on mentioning in many of our discussions. He actually himself, and I think Dr. Keith Edwards, who was in WEWAC at that time, by setting those pediatric standards for applying clinical services to children, I think that was something, those guidelines, pediatric guidelines that we had, they gave us real sound understanding of, executing health services for children. Those standard treatment books were go. And on top of that, I think the other thing that I really cherish is that we had very, very important mentors in all aspects of our health system, in pediatrics, in maternal health, the whole set of it. So the MBBS degree that we got at that time was very multi-purpose. We also had good rural health practice. We went out in Kainantu, for example. We went out there to do our community health programs there, and from there we were able to understand where our systems were working, how they were working in each part, and not confined to our province or district, but the whole country. I think we were able to understand the whole country better, I think. It'll depend on how people see it now, but I think we were able to understand the whole country in a more comprehensive, concrete way at that time.
Thank you. And I guess up by the 1990s, you were already a senior doctor working in Port Moresby. Would that be correct to say?
Yes. In fact, in the 90s, then straight after graduation, because I was sponsored by the Papua New Guinea Defense Force. So because of that, I had to go and join the military I became a regimental medical officer. And the regimental medical officer job I did in Port Moresby. And then after that, I went, we are in the regimental aid post at Murray Barracks. There's a regimental aid post there. So I did that there. And then I also became the second in charge of the health services. So I looked after the health center at Taurama Barracks. So that's where I did most of my clinical exposure. But at the same time, the critical thing, I was really fortunate, and I still thank God for that. At the same time, I was able to see clearly public health, because the military had public health interventions. It actually did a lot of research on pig bell. And then the pig bell story is another story. But well, I hope young people, please try and look at the history of pig bell. And you will find that transformation in pig bell would actually tell you a lot about changes in health systems, how it got eradicated, all these sort of things. It's quite an interesting insight. So, sorry, I'm getting off the point, but the point to be taken is, so those experiences I had in the military ended up making me think about public health. And that's when Dr. Quinton Riley at that time invited me to join the Department of Health as a senior specialist medical officer responsible for communicable disease in the National Department of Health. And from there, the rest is history, and that's when I'm sure most doctors would have now gone into different branches, like what one of my best friend, Dr. Malau, did. He went through, became a specialist in surgery, and then he now went to Angao Hospital as the CEO of the hospital there, and then he also went through that process through as a clinician.
Thank you. I was looking through your photos, the ones that you sent me, and I saw two names that appeared on the, I think MBBS 4, I'm not sure, you can correct me on that, who also joined the Defense Force. That would be late Dr. Billy Selby and Surgeon Dr. Frank Torova, whom both I know personally and worked with. How was it like then and now when you see your friends?
Oh, yes, my friend Dr. Selby left us. He was with me in Divine Word University as well, when we were there working together, when I was Dean of the Faculty of Medicine Health Sciences at the Divine Word University. And Dr. Torova was a great, surgeon. I think he was we communicated well, and it's always exciting to see them. There's many others. There were, I think, 28 of us in the same class, and we were so fortunate to be in that class as well. There's too many to name, so I can only share those photos with them. And I'm hoping that we can really have a reunion sometimes.
Yes,
To really
absolutely.
articulate our experiences. Yeah.
And with that, coming into the 2000s, and I guess the highlight here would be your appointment as the health secretary for PNG, and with it, the PHA system. We've discussed the PHA system in previous episodes, which our viewers can go and see. I will put the links. But I guess in this episode, what opportunities for growth and maybe for the next 50 years in our health system do you see that we need to do?
Thank you very much. One of the things that I may not have touched is our links with international agencies. I think during the National Health Plan period, we tried our very best, and that also happened when I was also in Numia, New Caledonia, where I facilitated the regional health program that enabled me to look at regional entities and work with them, WHO included, how we would work with them, and how we, and as I became secretary, I realized how important it was to work with international agencies. And that's where I saw the Paris Declaration on aid effectiveness and aid harmonization, and how it was critical that we worked with partners to enable us not to create systems to undermine us. They must be enabling our staff, enabling us as Papua New Guineans, as an independent country, to stand up for ourselves, to become independent, as already enshrined in our national constitution. So, given that scope of work with international agencies, then in fact, we were just about to be elected on the board of World Health Organization. Because I think this I must say, because people must also realize that in 2009, when there was lobbying going on to lobby for the regional director post, which was taken on by Professor Sin Yan Shun as regional director. I think this is really important that Papua New Guineans realize that we have an important role to play in the international circles of health as well, which I think is totally undermined. It's undermined because of parallel systems being created, undermining our own systems of government. And the Paris Declaration was very clear on this, making sure that a country has its own strong plans and procedures for outsiders to come and help strengthen those systems so that it will become truly independent. And it's enshrined also in our national constitution. The PNG way, not undermining standards or practice for the country, but the PNG way as its rationale. A diverse country like ours, how do we make it work? So that's why I think the face of my tenure as health secretary, I must also emphasize that we did our utmost. For example, we actually elected the regional director for WHO. There was only one vote in the regional committee meeting to make a difference. And you know who made that vote? Papua New Guinea gave that vote because we saw that it is not regionalism. It is not how the people handle themselves to help us, not to align too much with Australia or New Zealand, but let's stand up as an independent country. And Papua New Guinea gave that one vote for that reason. And if I know people may be, as I said earlier, in our other interactions, may be saying, oh no, he's wrong, but those are the facts. We voted for the reason Sasha Zibe, as minister, was advised to vote for the Korean because we wanted to align ourselves where we can. And there were Australia and New Zealand voted for the other person. I can't remember now who it was, but we voted for PNG because of too much fragmentation and too much not really supporting our systems of health by Australia and New Zealand. So it's about time, I think, and I'm speaking out here, that Australia and New Zealand realize that, particularly Australia, with the DFAT program, how it is helping our country. Is it helping us or creating fragmented systems for us? Thank you.
Thank you, Dr. Malau. Indeed, PNG has a significant role to play within the region. And you've highlighted where we fit in within the global picture. And it's important for us to also know that apart from our own national challenges, we do have a role to play within the international sector. And thank you so much for sharing those insights with people like us kind of only see what's out there, but coming from someone who works with this organization, it's very encouraging. Maybe it will also encourage some young Papua New Guineans to also go work within the regional organizations and also play a role within our region. Thank you again. Let's move on with our discussion, and I will kind of narrow our focus and discussion back to our profession, which is public health. And I wanted to ask you this specifically as a public health specialist and a practitioner for so many years, and reflecting on the growth of public health as a profession in PNG. What are some of the milestones in the last 50 years that you have seen? What challenges and opportunities do you see for professionals practicing public health as public health specialists in PNG?
Yes, I have seen, I think there's a lot of challenges. I've seen the mixture between clinical medicine and public health quite difficult to define. It become defined because when doctors become doctors, and when they become, in fact, get into public health roles, actually automatically without which is the same process I went through actually. Without training, you get into a public health role. Without training or without any insight into management skills, you just become, because you are there, you're a head of the health team, basically. Doctors are heads of health team. So you get in there as a public health person. So what I've seen is that we are lucky. In fact, doctors have been lucky to get trained in the way we used to get trained in the old days, where you look at very basic things. You do syndromic, basically, management of clinical diseases. You look at fever and you work out differential diagnosis and you work out the facts, why you have fever, etc. So that training, I think, to me, was really critical in the old days for us. I don't know what it's like now, but that training actually gave you already the ingredients to become a public health official. So you become tuned into that. So for any manager, I don't know what happens in nursing, I don't know what happens there, but for doctors, I think we did a pretty sound training to be able to translate into public health officials, but without proper management training. And this again was is emphasized to me even by Dr. Malau every time. Now it's become a deputy, well, it's become a chair, like deputy head of the Paradise Hospital. So we keep on talking about it because we became accustomed to public health through that process, not by formal training. So I think formal training is now needed because that actually, the formal training reminds me again of how patrol officers were trained too in the old days. They went through each community town in every part of our country to work out why people work out a registry of people. They get the 8-post orderly to work out their health status. They go to the people in the general administration to see the family trees of people. They work that out in detail, and then they'd come up with a proper structure for support as patrol officers at that time. So applying those standards now is not been done properly, I think. And one might realize the failure of us not getting back to the basics to do this is critical. And that's why training in public health is still critical. For the only thing I can note positively is the programs conducted at Divine Word University through the now I can't fully capture that part, but the program that's there under the Health Extension Officers program. Okay, the Health Extension Officers program. That's where I think that program might be encompassed into the program for health extension. In actual fact, one of the thoughts we had was to have the new medical school focus on rural health service and have the Divine Word University program actually do that as a second medical school. That was just a thought at that time, but I don't know how that would have been the case. But to try and support rural health services through another mechanism. And then we ended up having this PHA process executed for making sure that rural health services were encompassed through a stronger public health input, not just clinical. So I guess that's you can summarize somehow what that means. The public health system still needs support. We need training. We need more to get support for rural health services through a public health program.
Yeah, thank you. The health extension program, I think it's now called, they have renamed the program into what is now called Bachelor of Science in Rural Health. Right?
Oh,
Yeah. So
okay. Makes
and
sense.
and I agree with your perspective that a lot of students who go through that program used to be called Health Extension Officer program. Now it's called Bachelor of Science in Rural Health. They tend to progress into a public health role more compared to, say, MBBS graduate who tend to progress into clinical specialties like surgery, pediatrics, and OBGYN, the more lucrative, if I can put it that way, pathway. And that was evident as I was coming into MBBS too. Is that something that you also seeing
Okay.
or have observed?
Yes, I think that what you're saying makes total sense. I think if that can be done properly, more formally and supported, that could be a good way for the country because of its uniqueness. Because we've had this MBBS program all the time. Now we want a single university uh, in Port Moresby. But that was one of our debating points with Professor Isi Kevau and Prof. Vince. Um, we had debates over whether we had one medical school or two medical schools. But one of the key things I articulated while lobbying for the second medical school in Medang was if we have a single school, we will not have opportunity for creating quality standards because there won't be any competition. So as a result of that, I ended up going and running the second medical, creating the second medical school to do that rationale, under that rationale. So if we have two, then we'll do that. And now that you raise the issue of the uh, the 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 medical programs being done in such a way that we start focusing on rural health through more technically well-organized program. And that makes total sense, I think. Thank
Thank
you.
you. And that brings me to the next question why I wanted to ask. And you having graduated and trained from Harvard, one of the most prestigious public health training school in the world, and having worked with other public health professionals either trained in PNG or elsewhere, what's your opinion on a master's in public health from a national university in PNG compared to, say, another Papua New Guinea student who goes overseas to obtain their master's in public health?
Thank you. I must say, I thank God again for the opportunity I got given to go to Harvard. I really thank God because there I got most of my, I guess, the standards or qualities, I think, I must say qualities, as a public health official, qualities for a public health official. And I really must thank Professor Jonathan Mann, the late Jonathan Mann, who crashed in and died early for us. Hopefully, if he was around, we would have more dialogues with him because I became very close to him. The very close to him I got uh, because he had this notion of health and human rights, health and human rights. And then when you break that through, you find that you go into the issues of equity and health, making sure that people are not poor in a country, blessed country like Papua New Guinea. And yet, some of us are now seeing children begging for money on the streets in Port Moresby. You know, it gets me every time I go there. We never had this before. So it got, so this sort of training I got there really made me so passionate about people, human beings. They are human beings after all. We got training in public health, but people are what we should strive for: equity and making sure that they have shared benefits of the land that we have. the cultural diversity that we have. There's so much land we have. We've got nearly 10 million people, though it's not been quantified properly yet. But the assets that we have, you quantify it and you'll find out exactly how much gold, copper, oil, gas. And that's what frustrates me all the time. So Harvard gave me that notion of, look at your country, only 10 million people, but the assets that we have is how much? Oi, are we doing any good for our own country? So Harvard taught me those values, and I'm really passionate. So if we can create something within Papua New Guinea, let's do it. A public health program that will ensure that we do not defeat the basic values for human rights in our own country. Let's do it in such a way that we are able to give every single man, woman, and child the opportunities for a better future for all our people, not have children begging for money in a land of plenty. So I can say these are the values that Harvard gave me. Nothing complicated. There's no complicated science in it. But those values by people like Professor Mann, Dr. Ian Aitken, who I met as a student at Kundiawa. Sorry, not Kundiawa, Kainantu, and whom I met again at Harvard. What a blessing from God. Thank you.
I know UPNG as a MPH program that it's in existence, but I'm not sure about the curriculum, how it's run. I opted my MPH from Divine Word. I couldn't leave work and go, so I had to do it as a part-time extension student. From what you were saying, I'm getting the impression that health equity and human rights should be a core component of any public health program we try to do in PNG.
Hold on. I think you're perfectly right because of the complexity we have in our society. We make it as basic as possible, as down to earth as possible in the different societies and groups and villages and clans that we deal with. Exactly. Thank you.
I guess now I want to really focus down to a more personal level for you. And I have written this statement down to ask you this afternoon. On a personal level, looking back on your career, what things would you have done differently and why?
Yes, first I think I should have actually taken a bit more time in doing things where I was supposed to do. For example, the Secretary for Health job, only 4 years, and I didn't have the time to do it. Even the Director of National AIDS Council, I had only 4 years. So in most of timing was a factor for me. Many of the factors that were that I just mentioned, timing factors, were, I think, beyond my control. But I think I wish that I would have done and spent more time, particularly as Secretary for Health. Maybe I would have made better. So that's my biggest regret. Second, I think, is the way I conducted things might not have been correct, but there was no feedback. I never had any way, maybe because people thought I was, secretary and that's it, you are. No feedback on anything that I would have failed in. I think those are the two things that I feel totally regrettable. If I had maybe got more feedback, I would have done better. My timing in each of the positions I tried to do were too short. And maybe I must say, on a personal level, all I can say is I did my best. I did the best I could based on the values I was given, again from Harvard, and I guess my cultural values as well. Altumbuna talking to me plenty something too, where it's still in our blood and bone. So I could say those were the three main things that that could have made systems go bad. Even selection of individuals that were done transparently, I think. Although the individual selected may have done things improperly, but still that requires total audit. So the failure of getting proper feedback was a critical element in any of the failures that I would have made as Secretary for Health or as head of a section at that time.
Thank you.
And again, maybe someone else can also judge me on that as well. Total audit on everything, including some of the most recent things I tried to do as a consultant with WHO. I think a total audit is required so that any failures that I would have done can be highlighted for correction by future people that want to be in the roles that I took.
All right, so we are about to come to the end of our discussion for this afternoon, and I have two more questions to ask. The second last question is, finally, what advice do you have for our young people in PNG?
Young people, I think all I can say is, our diversity has also given us genetic diversity as well. So I would say, given the global environment, Papua New Guinea has got a genetics capital with the sort of things I'm seeing. Pilots up in the air. Wow. For a country not more than 50 years old yet, doctors being specialists everywhere, going to Dr. Itaki being in American Samoa. What does that tell us about our genetic makeup? I think we have the brains. That's an asset that we shouldn't forget. So be innovative, young people. You have the talent. You have the talent. All you do is think about things maybe slightly differently from what you've been used to. Think about it openly, explore the world, and you will get, I think, innovation in yourself. It will now depend on leadership that manages us. The leadership that acknowledges and manages all the assets that we have, the human beings that we have. That we do not go talking about insurance schemes that are biased towards individuals, but start talking about the whole community, the whole country, that we do not just talk about public servants, but there's a whole country out there as well that needs to be taken care of. That's the sort of mindset I'm hoping young people can take with proper insight into the system, because many of us just came from nowhere and we became who we are because of open-mindedness. That's all I can say. Be open-minded and do the right thing for the good of all.
Thank you, Dr. Malau. And finally, what is Dr. Malau doing these days, and what's next?
Well, I'm thanking you again, Dr. Itaki. I'm thanking you again because what you're, I guess, that we're now doing will hopefully guide us to what we do next. I always tell my own family here, look, guys, I've got only 20, maybe 10, 20 years left. And I feel rather frustrated about not being able to do anything for my country. So I am now in the village, going home to do land mobilization, because I realized during my period of work, I've also missed my cultural values, and particularly the cultural values related to land, because land is where, 95, maybe 97% of our land is owned by the people. So get back to your land, do the right thing, and hopefully you create models from the land up. So that's what I'm doing. I just, I'm just, trying to go back home, fix up my visa, get back home and do the things, going back and forth from home to do land mobilization. And I'm hoping I can share this with folks later on when I see some evidence of results from what I'm doing in the village. I guess that's my future. But if people ask me, I mean, I've been excited about your uh, this interaction that we're having, because this will hopefully open or keep me excited as well, and be able to do things where I can, rather than just fizzle off and just have the stress, and you just fizzle off into the into space, I guess. So that's what I'm hoping, and I'm hoping that our dialogue would also create some hopes and opportunities, not for us only, but for young people to do the right thing, as what we're trying to do or what we're discussing. Thank you very much, Dr. Itaki.
Thank you, thank you. I guess you have come a full circle from the village. You went everywhere, and now you're back to the village, back to the land.
Thank you. God bless you.
And
Yes.
I think the last point of land is a key message for us young people, that PNG is unique globally in that more than 90% of the land, river, trees, mountains, resources is owned by the people. And we forget the 90% that we have, and we focus on the 10% which we don't have. And
Yes.
and so thank you for that nice reminder to show us that land is there for us to make use of it, to where we were born into and where we will be buried. And as all Papua New Guineans, regardless of whether they are full or 50 or quarter or whatnot, PNG or from Australia and New Zealand mix, they will identify themselves with a land, a name, a tree, a river, a mountain, and that's our identity. Thank you so much for highlighting that, Dr. Malau.